Call this meeting of the Legislative Audit Commission to order. Today we have an agenda overviewing the Legislative Auditor's Annual Performance Review and a presentation on a performance audit. We are conducting this meeting as a hybrid. There are members who are participating virtually, so it may take a moment if they have questions, just to make sure the audience is aware. It may take a moment for us to make sure we get everybody participating if they have questions. So we are going to start off with an overview of the performance review. Michelle Urich, Executive Director of the Legislative Coordinating Commission. Welcome, and if you could state your name for the record.
Thank you, Mr. Chair and members. I'm Michelle Urich. I'm the Director of the Legislative Coordinating Commission, and I provide logistical and administrative support to the annual performance review of Judy Randall, the Legislative Auditor. In your packets, you have two materials, two documents. One is the policy that was adopted by the Legislative Audit Commission related to the process for conducting an annual evaluation of the Legislative Auditor. And then the second document is titled Legislative Auditor Annual Performance Evaluation Work Plan. The work plan was approved by the Executive Committee on October 13th, and the policy requires that the Executive Committee approve the work plan and timeline at least 30 days in advance of the evaluation taking place. The evaluation includes multiple components. It has a self-assessment, which is completed by Ms. Randall and submitted to the chair and vice chair of the Legislative Audit Commission. It also includes a number of interviews that were this year conducted by Representative Quam and Senator Rest of staff within the Office of the Legislative Auditor, as well as an agency who was reviewed by the Legislative Auditor's Office within the review period, which is the last year. The findings from those interviews were then conveyed to Representative Hansen and Senator Curran as the chair and vice chair of the Audit Commission. And this morning, then, Representative Hansen and Senator Curran completed the formal evaluation of Ms. Randall as the Legislative Auditor. This process is the process that is followed for the 2-year period, each annually, but the midpoint of the 6-year term does involve a more comprehensive evaluation, which is conducted by a third party. And so I just wanted to flag that for the commission that over the next year, I'll be looking to work with you if you'd like the LCC to provide some support to obtaining a third party to assist with that midpoint evaluation, which would be due next year. And with that, I'm happy to answer any questions on the process.
Thank you, Ms. Urich. Any questions from members?
Mr. Chair, I'd just like to add a couple of comments. Thank you, Mr. Chair, and thank you, Ms. Urich. We appreciate your guidance and the participation to keep us all on track to move through the process. As everybody knows or may not know, we put this process in place 3 years ago. I think 3 years ago. And what really has come to a fruition of working very well and providing some transparency and organization or some prescriptive definition of a good process and good governance, which we haven't had in the past. It happened, but it wasn't out in the public, wasn't well known, and it wasn't well organized. And so we've done that, and I think it's been great for everybody. I'd just like to add, we had, as a result of the process, we had a couple members do interviews with agencies and staff, and that was Senator Rest and Representative Quam, and they did a great job and received great feedback. And so we conveyed that, and it really was reflective to what we think we've seen in the work of the Legislative Auditor. And Ms. Randall taking over this role, I think 2 years ago. Since then, we've seen great structure, organization, and a succession, an opportunity that any future succession from this point forward will be well handled and well guided, not only because of process that she's instilled, but the positive feedback we received from the employees about sense of value, worth, and inclusion and in the process. And we thank everybody for that. And they've done a great job. They are vital to Minnesota citizens and us as legislative members. They're our eyes and ears, and we need them to function very well. So we also then heard back from agencies in which they where they perform all of their work and where they live most of the time. And I think it could be described as healthy and adversarial. And that's exactly what we want. There's a healthy conflict there, which all their work could be seen as that. We look at it as great vital work to dig out and to understand that agencies are in full compliance of law and investigate where they're not and inform us so we can act as a legislative body, but also to inform the public about the health of our governing bodies and their impact on citizens. So we commend the legislative auditor, her staff as well. She's completed as a part of this process. She has her annual reviews for the deputy auditors, and those are done and have gone very well. So we think we're in a very good spot. There's lots of work to do, not for lack of desire and skill sets, but we'll, in fact, the audit we're going to hear today is we're trying to continually build and grow. This process is 50 years old, I think. It's continually evolving as work evolves and as we evolve, and to make sure that we make sure that the legislative auditor's role and position is well staffed, well funded, and well supported, so we can get the things we need out of them for us. So with that, Mr. Chair, we give Ms. Randall an exceeds at all levels review, and we're extremely happy, and we're going to continue to support her on her role. Thank you.
Thank you, Senator Cramp. Members, any other comments? Any members online? Director Urick, do you believe we've followed the procedure as we've indicated through policy and statute?
Mr. Chair, yes, I do.
Thank you. Thank you, Ms. Randall, for your work. And I think we are going to move to the presentation on the performance audit now. Welcome. We have the presentation on the performance audit Minnesota Board of Aging Senior Nutrition Program. Lori Layson, Deputy Legislative Auditor, Financial Audit Division. Welcome, and state your name for the record.
Thank you, Mr. Chair. For the record, my name is Lori Lyson. I am the Deputy Legislative Auditor for the Financial Audit Division at OLA. And we are happy to be here today to present our audit of the Senior Nutrition Program, which is administered by the Minnesota Board on Aging. I think it helps just for a frame of reference to think of one of the providers here, and that is Meals on Wheels, which is a program which adheres to and receives money from the Senior Nutrition Program, and they deliver meals to seniors. And that is, something to keep in mind as we go through this report. And you'll see in our audit, what we did is we really took a deep dive, and not only did we look at the Minnesota Board of Aging, but we really went down all the way to the participants themselves. So we looked at contractors, subcontractors, and even the participants. And if you've had an opportunity to read our report, you will see that in our conclusion, we do have some serious concerns with how the program is administered and the oversight over that program. I'm going to turn the presentation over to our audit director, Ms. Stone, who will provide the details of our report. And again, I want to thank you for the opportunity to hear our report today.
Welcome, Ms. Stone, and if you could state your name for the record.
Good morning, everyone. Mr. Chair, members of the Commission. For the record, my name is Valentina Stone, and I'm an audit director at the Office of the Legislative Auditor. And I was the project manager on this audit. Before we proceed to the main presentation, I would like to acknowledge the audit team that worked on this audit, and they are here in the audience. We have Shannon Hatch, who was the team lead on the audit. We have auditors Zakia Tadiz, Eric Wynn, Eric Olson, Alec Mickelson, and we also received help from the Program Evaluation Division from David Kirchner. And now we will proceed with the main presentation. Senior Nutrition Program is a federal program that delivers meals to individuals who are 60 years or older. It's the purpose of the program to reduce the hunger and provide socialization for those older adults. It's not intended to serve everyone, and it's targeted primarily to those who are in a greater economic and social need. The meals either delivered to participants' home or served in a group setting. According to the data from Minnesota Board on Aging, during calendar year 2022, the program served approximately 3.1 million of meals to approximately 40,000 of the participants. The main objectives of our audit was to determine, first of all, how well the Minnesota Board on Aging and local area agencies on aging managed the program. And did the Minnesota Board on Aging and area agencies, including service providers, comply with the main requirements for the program? During this audit, we looked at the program operations that took place between January 1st and December 31st of 2022. In the state of Minnesota, the program is administered by a variety of entities. First, it starts with Minnesota Board on Aging, which is staffed by the Department of Human Services employees. Minnesota Board on Aging establishes the network of local area agencies on aging, awards funding to those entities, and provides monitoring and technical assistance as needed. Then area agencies on aging, which are established by the Minnesota Board on Aging, perform administration of the program at the local level. Among functions that they perform, they sign contracts with service providers, they monitor those providers, award funding, and provide technical assistance to those service providers. In calendar year 2022, there were 7 area agencies on aging. Then we have service providers, and in calendar year 2022, there were 17 service providers. The service providers provide a variety of functions for the programs. They enroll and recertify participants, prepare and deliver meals, provide outreach for the program, manage volunteers, and perform other functions. If for some reason these service providers are unable to perform all those functions, they outsource some of those to subcontractors. And typically, what is outsourced to subcontractors is meal preparation and meal delivery. However, we also found that some of the subcontractors also registered participants on sites and collected voluntary contributions from those participants. As we can see on the map, each area agency on aging is responsible for administration of the program in certain counties. It is done to ensure that services are available throughout the whole state of Minnesota. On this slide, you can see in the exhibit on the left, in calendar year 2022, Minnesota Board on Aging received approximately $23.8 million to administer the program. And most of this funding came from the federal award, 89%, and the state portion accounted for the remaining 11%. Then the program expenditures, as we present in the exhibit on the right, you can see that approximately 32 of the expenditures went towards program administration and management. And this program administration expense is split between service provider, area agencies on aging, and Minnesota Board on Aging. And typically, these costs included payroll, included HR, IT, accounting staff, and so on. The remaining 68% were spent on direct program services. And examples of those costs include such costs as payroll for cooks, kitchen staff, outreach staff, and so on. It also includes cost of raw ingredients to prepare meals and payments to subcontractors for direct program services. In addition, the program is funded with a local match, which primarily comes from in-kind contributions, and a small portion is coming from voluntary contributions from the program participants. These two items are not included in this 23.8 million that we just discussed. Area agencies on aging reimburse service providers based on rate per meal. And those rates are calculated based on estimated total cost for the program divided by the estimated total meals that service providers anticipate to serve during a period. It also takes into consideration estimated voluntary contributions from program participants. And those contributions are deducted to arrive to the final reimbursement rate. And as you can see in this exhibit, the rates ranged from as low as $4.65 to as high as $30.37 per meal. As Ms. Lyson mentioned earlier, we had significant findings for the administration and management of the program. And we generally concluded that Minnesota Board on Aging and area agencies on aging generally did not have sufficient controls to ensure that the program operated as intended, and generally did not comply with significant legal requirements for the program. And our findings were across almost all areas of the responsibilities, starting with the missing documentation and through quality of the program participant data in Minnesota Board on Aging database. And on the next few slides, I will emphasize the most important findings that we presented in our report. There is a specific requirement where all participants, before they consume the first meal, they should complete an application and at a minimum provide name and date of birth. Then these service providers will use this application and enter this data in Minnesota Board on Aging participant database. This database is used to track participant demographic information, number of meals served, where the meals were consumed, and what type of meals participant received. Then annually, service providers are required to recertify all of the participants in the system. And the purpose of the recertification is to ensure that participants still willing to participate in the program, that the data is still accurate, and that the participants are still alive. We selected a statistical sample of 581 records from the database, and we found that for 296 of those records, the recertification forms were either missing or the data on those forms did not reconcile with the data in the participant database. For example, the date of birth or the name of the participant on the form did not match to what was recorded in the system. Another area of concern is related to the monitoring. Minnesota Board on Aging is required to follow Office of the Grant Management policies on monitoring. And those policies, among other things, required site visits, financial reconciliation of expenditures, and closeout evaluations of grantees' performances. And we found through our audit that none of these activities were conducted in calendar year 2022. And per discussion with Minnesota Board on Aging management, it appears that no monitoring was conducted since at least 2017. The next area of concern relates to the monitoring by area agencies on aging of service providers. Minnesota Board on Aging requires area agencies on aging to conduct on-site monitoring visits to a certain number of sites. And the purpose of those visits is to ensure that the sites exist, serve eligible individuals, provide meals that meet nutrition guidelines for the program, and that meals are served in safe and clean environment. Our audit discovered that 6 out of 7 area agencies on aging either did not complete site visits or did not complete a required minimum number of those visits. In addition, as part of our audit work, we conducted a survey of program participants to determine the quality of the data in Minnesota Board on Aging participant database and to receive a general feedback on the program services. We issued the survey to a statistical sample of 1,400 participants, and we received a response rate at 23%. That means that 23% of those who we mailed survey responded to our survey. We do understand that survey results do not allow us to conclude whether or not the specific noncompliance has occurred, but it did allow us to identify certain area of concern and increased risk for noncompliance. Approximately 10% of all the surveys that we mailed came back as undeliverable due to insufficient or incomplete addresses that we used. And we used the addresses that were recorded in Minnesota Board on Aging participant database. Then responses from program participants identified additional concerns. Based on the results, approximately 13% of those who responded indicated that they received the different types of service than what was recorded in system. For example, participant responded that they received home-delivered meals, but in the system for that participant, it was listed that they consumed meals at the congregate site. Then 19% of those who responded indicated that they did not receive any meals for the program. We do acknowledge the fact that it is difficult to remember events that occurred in the past. And even so, if the participant received very small number of meals in calendar year 2022. However, we did have several participants who received significant number of meals, between 112 and 669 meals per person, who indicated that they did not receive any of those meals for the program. And the last concern that we identified through the participant survey relates to the requirement to pay for the services. There is a federal requirement where service providers must provide an option to program participants to contribute towards the cost of meal. But it specifically states that this contribution must be purely voluntary. According to survey, 37% of those who responded indicated that they were required to pay at least for some of those meals.
Ms. Stone, we have a couple of questions from members. So Representative Quam.
Thank you, Mr. Chair. And looking at that, I'm assuming if I add the percentages up, there's only 21% without any issues. So I assume there's some overlap between the 13, 19, and 37%. So how many of the responses, what percent didn't have any of these issues that you've actually noted here?
Ms. Stone.
Mr. Chair, members, so these results, so we had 23% of the respondents to our survey, which is approximately a little over 300 individuals. So we asked them different questions, and those percentages are based on those questions. So when we say 13%, it will be 13% out of those 300 that responded to the question on what type of services that they received. Then we talk about the 19% that did not receive meals, it's also 19% from of those 300 that responded to the question when we asked if they received those meals.
Representative Quam.
Thank you. I can read the numbers. The point I'm getting to is the only one that wouldn't overlap is 9%, 19% didn't receive meals and 37% were required to pay for at least some meals. That means that over 50% of the people that you queried had issues there, plus another 10%. So you're up to almost 2/3, 65% or 66% that had problems. I'm wondering how much of an overlap of the other 13%, or is there actually a 79% of the people that you did the surveys on, either the addresses were bad or they had one of the, one of these three problems. I'm trying to find, because that's important. Because we already see from here that there is definitely over 50% where there's major issue. And so that's why we need that kind of detail to understand just how catastrophic this extent is, because we've got this program to help people. And if there are problems showing up here, we don't have too long to look back. Well, actually, we do have years to look back on the feeding our futures and that. And I would think that, people would have seen, oh my goodness, let's look at what we're doing. But I'm not seeing it from here. So if maybe offline or afterwards, you can tell us what total percent had no issues, that would be useful. Thank you.
Ms. Stone.
Mr. Chair, members, yes, we can provide this information after the meeting.
Senator Rest and then Senator Cran.
Thank you, Mr. Chairman, and thank you for this report. When I look at those numbers, the first thing that I pay attention to is this is a self-reporting survey. This is not the statistics that are reported by the agency or the contractor. This is, if I'm wrong, correct me, but it says it's a participant survey. And we know that there is no requirement to pay for these meals. However, when a letter comes that says you could really help out if you can by contributing to the cost of these, some people are going to read that as in order to get the meals, they're required to pay. And I think there's just ambiguity, perhaps in the way in which the questions were phrased, or ambiguity in the way in which they were understood, rather than a bold statement from the contractor saying, or whoever is delivering the meals, I don't know the correct word there, but that these meals are free, period. And are no they're not free in a sense, but no charge to the recipients, period. The mistake in my mind is adding that separate sentence in the form that says, but if you can and you would like to help out, that'll be just fine. Some people are going to take that as, we really expect you to pay. And therein lies the fault, not whether they're actually required, because we know by law they're not required. And, I really appreciate Representative Quam bringing out, how these percentages add up, and in all of them, you're looking for, you're dealing with samples. You're not dealing with everybody. And so you're looking for statistical significance of the samples. But this particular one is very troubling if indeed the form itself or whatever communication they get seems to imply that good people pay for them. How come you're not? And then the person thinking that they are then required to pay, even if following that, they don't pay. So it's kind of imposing some sort of guilt trip on recipients for something that the state has determined that they are eligible for, that they deserve, and that without any apology from the recipients about why or if or why do they even have the understanding that somehow they are, that this many people, even of the statistical sample, are required to pay for them. That's got to stop. And I hope it has.
Ms. Stone.
Mr. Chair, members of the committee, yes, you are absolutely right that this is a self-reported information. And there is a fine line between required to pay and voluntary contributions. And as we suggested in our finding in the report, that the communication between service providers and participants could be better to clearly state that this contribution is voluntary.
Thank you. Thank you, Mr. Chair.
And perhaps site visits or monitoring would clarify that for the
Yes.
providers and the recipients. Senator Cran.
Thank you, Mr. Chair, and Ms. Stone. And following along the same line of questioning. So the participant database is what the survey is where you mailed them out to. 22% of the people responded of. So I'm just trying to see was there a way to extrapolate those that you sent out to? 22% of them responded. You sent out what, some 1,500? How many total people are served by this program?
Ms. Stone.
Mr. Chair, members of the committee, this is a good question. The total number of individuals were approximately 40,000. And we selected a statistical sample of 1,400 out of those 40,000. And our response rate was 23%.
Mr. Chair.
Senator Cran.
And thank you, Ms. Stone. And but 22% is pretty good. That's a pretty good response. And to have 37% of them pay for service or believe that they had to. How is that accounted for? I assume that's all cash. And were payments made do we have any idea the track were payments made in cash or any other method? And were they for meals delivered or meals provided in a facility?
Ms. Stone.
Mr. Chair, members of the commission, this is a very good question. The contributions are collected in a variety of ways. If a person comes to the congregate site, there will be on some sites a collection box where contributions could be put in. If the person receives meals delivered to their homes, they typically will be sent a contribution letter at the end of the month or at the end of the period, where it will be indicated how many meals they consumed, and also will be indicated a suggested contribution per meal.
Mr. Chair. So Ms. Stone, so with that, you're saying that they do track that payment made, and you said that receipt or that annual reconciliation or the annual report says here's the meals received by you in addition to contributions that you made. So they have a reporting mechanism for that?
Mr. Chair, members of the committee, there is a reporting mechanism, and all the service providers are required to report the total number of contributions collected from the participants to the related area agencies on aging. And then this information is reported to the Minnesota Board on Aging.
Thank you. Thank you, Mr. Chair. Thank you, Ms. Stone.
Any other questions on this point? Proceed.
Thank you, Ms. Chair and members of the committee. So the general recommendations for Minnesota Board on Aging and area agencies on aging relates to Basically, we suggest to Minnesota Board and Agent to provide clear and consistent guidance to area agencies on aging in order for them to administer program at the local level. And we also recommend that Minnesota Board on Aging provide sufficient and consistent oversight over the operations of those agencies. For area agencies on aging in general, we suggest that those agencies comply with the requirements of the program. And in order to do so, we recommend for those agencies to work with Minnesota Board on Aging to clarify and understand all the requirements for the program. At this point, we do not have any specific recommendations for the state legislature because the program is heavily regulated by the federal government. However, program does use some amount of general fund, and we would encourage legislature to ask good questions and provide oversight for this program. With that, I will conclude my presentation. And if you have any questions, we would be happy to answer. Thank you.
Thank you. Members, do you have any questions? Representative Anderson.
Thank you. Is there data in the report that shows the dollar contributions? I'm just wondering how closely this might track with what we're actually hearing. The contributions that folks made.
Ms. Stone.
Mr. Chair, members of the commission, we do not have specific dollars for the contributions because we did not look in the details in the contribution and we did not test those contributions during our audit.
Okay, thank you.
Representative Anderson.
I guess, is the agency going to testify next?
Yes.
Yeah, I'll hold my questions until then. Thank you.
Senator Rez.
If they are unsatisfactorily met, or is there any response whatsoever from the federal government other than to note those statistics?
Dr. Lyson.
Thank you, Mr. Chair and members. So we, as you know, no longer perform the federal single audit. However, the state auditor's office does perform that. So this is information that could be shared with them and should be shared with them so that they could look at that when they perform their risk assessment in determining which programs to look at when they start that single audit. So very good question and something that could be shared with the state auditor's office.
I want to make sure I'm not missing anybody online. Representative Kwong.
Thank you, Mr. Chair. It's interesting. I saw through there, you noted 2017 that they haven't done some of the required things since. And I would think that would automatically cause the auditor to look at them. And then it does make me wonder, have we or have they been audited in any fashion since 2017? And are we finding things that weren't discovered in previous audits, or it just happens that they haven't been audited since then?
Dr. Lyson.
Thank you, Mr. Chair and members. So we, as the Office of the Legislative Auditor, did perform that during that time frame. I cannot tell you with surety whether or not that was a program that was picked up in the past. I do not recall in the recent past when we had performed that. So I would have to look back to see exactly when that may have been picked up as a federal program. But we don't know always, right, if there is not strong performance in an area. So unless we're equipped with that information and have been informed of it, when we look at our risk assessment, and that is really what we're looking at when we determine which federal programs to look at, we're first and foremost looking at the size of the program. And so typically back in the day, it may have changed a little bit. That's right around 30 million. So it's a federal program that has approximately 30 million of expenditures, if not more. So that's kind of the baseline of what would be considered a program that you would look at for the federal government. And then you start to do kind of this risk-based look, and you look at other factors, any known factors, any past performance, anything that would give you an indication that this is a program that we would need to revisit or go look at for the first time. And we also look at any federal activity and whether or not that's a program they're looking into themselves. And then the federal government itself provides requirements that you must look at during the federal single audit. So we don't necessarily come up with our own requirements for that program. It's determined by the federal government. And so I can get back to you to see if there was something in the single audit in the past. And I'm not aware of in the last year or two with the state auditor's office, what programs they have picked up. But again, with this understanding of there being this risk, that is something that the state auditor would want to consider moving forward.
Representative Quam.
Thank you, Mr. Chair. I'm not sure who the appropriate entity should look at this, but as a legislature, we've seen the federal government say, oh, there's issues, and they've clawed back to whatever the appropriate term funds from Minnesota. I think especially with the transfer from the legislative auditor to other entities, that we as a legislature need to have a good or better oversight on some of these programs. And I'm hoping that the chairs of the committees could get together, or maybe our chairs and their chairs, but we need to make sure that we find something, we avoid future, because, frankly, we don't want, once the federal government sees that you're a repeat offender, we might get more scrutiny. And frankly, we'd like to help the people and avoid the fraud. So that's why we need to enforce. So just for future discussions.
Thank you. I have a question maybe to elaborate finding number 6 and finding number 7. I think you'd mentioned in the slideshow that there hadn't been site visits or monitoring since 2017. And obviously we had COVID during that time. So I'm trying to figure out, is that there wasn't any in 17, there wasn't any in 18 or 19. Obviously 20, 21, 22, we had challenges. Was there, back to it in 22? Just maybe a little clarification on what the findings, number 6, which says the Minnesota Board of Aging did not conduct any monitoring activities for the senior nutrition program, and most area agencies on aging did not perform the required number of site visits on service providers or subcontractors. What does that mean?
Mr. Chair, members of the committee. As stated in the finding number 6, Minnesota Board of Aging did not conduct any of those required monitoring activities since at least 2017. And those required activities are site visits, financial reconciliation of advance payments, and grant closeouts. There were various reasons for that, and we would defer this question to representatives from the Minnesota Board on Aging to explain in details why these activities were not conducted.
Members, any other questions for the auditor? Senator Krantz.
Thank you, Mr. Chair. And so, Mr. Chair, you just brought up and you highlighted no reviews, site visits. I mean, it goes back to the simple question: did the sites even exist? Do we know that all of the sites exist? From, I think the total of what, there's some 17, the hierarchies up to Board of Aging, some 17 providers, and then 130 sub providers or service providers under that. Do we even know if those sites exist?
Ms. Stone.
Mr. Chair, members of the commission, this is a very good question. We identified 338 sites across Minnesota that provided food services for the program. And as part of our audit procedures, we visited 16 of those sites, and we conducted those visits unannounced to determine if the sites existed and if they provided services as appropriate. But there is always a risk that some of the sites may not have existed because, as we identified in the report, we had a concern with the monitoring by both Minnesota Board on Aging and area agencies on aging.
Mr. Chair.
Senator Grant.
Thank you, Ms. Stone. And when we look at it, I mean, if that lack of monitoring since 2017, COVID's not the excuse. 2017 is long before. 6 years, that's $144 million that went through a program with very little oversight. Then you look at slide 9, following up with, of the data they did collect, your information shows that 46%, almost half of all of it, was either missing or inaccurate. Was it more missing or inaccurate?
Ms. Stone.
Mr. Chair and members of the committee, yeah, as we describe on, I believe you refer to the exhibit 11, where we are talking about the recertification forms.
Ms. Stone, at slide 9, where problems with participant recertification, 296 out of 581 forms are missing or inaccurate.
Ms. Stone.
Mr. Chair, members of the committee, that is a good question. So as we described on the exhibit 11, out of 296 forms, 279 were missing, which means that the recertifications did not occur on annual basis. And then for 17 of those forms, we found inconsistencies between the data as recorded in Minnesota Board on Aging database and the recertification forms, where the either birthday didn't match or the name of the participant didn't match.
Thank you, Ms. Stone. Mr. Chair.
Senator Grant.
And so with another part of the report also highlights of the $23 million, well, 23.8 or almost $24 million spent annually. You indicate that 30% of that funding went to administrative costs. And so that's $6.9 million, almost $7 million to administer this program. Do we have anything to compare that to? That certainly seems like a large amount to use for administration in this type of program.
Ms. Stone. Director Layson.
Mr. Chair and members, thank you. So we don't have anything to compare it to because we do know that programs can really fluctuate within federal government of how many administrative, the percentage of administrative cost. I think our concern with the large percentage is that there is no oversight from both the Minnesota Board on Aging and the area agencies on aging. And so when you're not providing that oversight, you're not doing site visits, you're not doing financial reconciliations, you're not looking at the closeout, and you have this 30+% that's going to administrative cost. What is being done, right? Can you explain? And that's a question for the Minnesota Board on Aging. What is being done with that money to oversee the programs? So that is our concern, but we don't have something to compare and say that that is a reasonable percentage of administrative cost.
Mr. Chair, and thank you, Ms. Layson. I would agree. So if you're not, based on the data collected, barely half of the information is collected. The rest is inaccurate. Very little or no oversight in the real basics, right? Make sure that the site exists. We've seen with that, right? I don't want to beat up the feed in our future, but these are consistent stories that are years and years old. And so I've also looked at the response. We'll take that up with the Board of Aging, but it's like, we'll try harder tomorrow. It's been their core responsibility for many years. And so those things raise great concern for me. And so these are vital dollars. Again, just take 6-year program, $150 million. And so we need to make sure that at least the basics are done. And if you're charging or consuming $7 million of the $24 million in administration costs, they should be doing something. We should be a lot closer to perfect than we are 50% accuracy. With that said, I don't have any further questions for you guys, but I just want to let all members know that this is our first stab at a multifunction review. So a program review for people that are watching, both of them. It is really about the first time we've taken a snapshot at a program review and a financial review, a combined review. What we're really trying to do is look at, these are very complicated programs, and almost all of them start, as this one does, at the federal level, and dollars are associated with it, rules are associated with it, and then it cascades down to a state agency. And this one was chosen because it is something to cut our teeth on. And what our ultimate goal is really to look at the federal dollars. We always have a match to that. What are the real dollars? What is the hard dollar value? And what is the impact of the value of that dollar based on the rules applied? And they all cascade. And in a normal scenario in Health and Human Services, that moves into Center for Medicaid Services issues, right? We receive the money, we receive a lot of rules. They consume dollars, they impact the outcomes, and then it goes to the Department of Human Services, typically, or some other state agency. Then it cascades down to the county, that same dollar. So what we're trying to do is see what is the impact of the dollar, what's the real cost of the dollar as it cascades through the life cycle of 4 different entities before it reaches the actual people who provide the service, say in a nursing home, group home, and in this case, we got a bunch of service providers. How much is that dollar of the total program cost? How much of the dollar is left when it gets to those vital services? And then the impact of the rules on the card cost of the dollar and the outcome of the program. This one's feeding people and is critical and vital. Many of the other services we spend billions and billions on are really health related, group homes, disabilities, right? Vital services, elder care facilities, assisted living facilities, and nursing homes. That's really what we're trying to build. And so I appreciate the team. I've heard positive feedback from the team. We hope that we build upon it because we want to get to the point where we know what the cost of those dollars are and we can determine the value of it throughout its entire life cycle. It's our obligation to make sure people know and understand. But I think as legislative members, we don't know what the costs are. We measure expenses and expenditure at the highest level, but we've never looked at what is the actual impact on the rules and the outcome of any program. And so I commend the team for it. I really do appreciate it. It's something that I think is greatly needed. And so we're going to continue to build upon it to make sure that we have the greatest eyes and ears on the ground. And so we can legislate in the best manner possible. And this is the first step to it. We've never done this before. I've asked, and we've been working on it for some years to try and get this through. But I think it's really critical for us effectively as legislators to do our jobs. And, I use the scenario, they'll get tired of me saying it, but if a motor company can determine what it costs to paint the heads of the screws on an interior door panel, that's what they're required to do to function and to compete in their product. We owe the same obligation to be able to make those determinations or look at it so we can make sure that those outcomes and every dollar hits the people who actually provide the service. So that's what we're doing. So I just wanted to take that minute to let everybody know that's what we're going to continue to build upon. And if we're going to invest in anything, this is the area we should invest in. So thank you, everybody. And thank you for your entire team too. Thank you.
It's interesting.
Thank you.
I am very impressed with this move toward a comprehensive audit. And we don't often get in our request through the Program Evaluation Committee this kind of request, but it seems like to me that the commission itself can direct the Program Evaluation Subcommittee to that there will be at least one of the 6 or 7 topics, because I'm assuming this kind of a topic takes more time, more effort, takes both financial auditors as well as the program evaluators. But it is an extremely valuable study that we've had, and we should be very careful of doing from the federal dollars to the Minnesota local recipients. But I did note as well, someone commented, you know, something hasn't been done since 2017, although this program has been in effect for federal dollars since the mid-60s. However, the Board of Aging did go in its budget review and ask for dollars that could be devoted to or allocated to administrative costs for doing it. These things just don't happen all by themselves. These employees are not volunteers. They're not being asked to stay after and wait and work 3 or 4 more hours a week to do the things that the state should have assumed responsibility of needing to do and to pay for it to be done. And I hope that as we look at other comprehensive program evaluations, financial audits, that becomes one of the key questions. And to say they didn't get administrative funding is not an excuse. It's not an excuse and cannot be accepted as an excuse for not doing the work, but it certainly is a reason. And we should be paying attention to that. I don't know what committees in the House and the Senate have jurisdiction over the Board of Aging? Who does? Who does? Who does? Human Services, that we, you know, that we make sure they see this and answer that question. Was, you know, 15 to 20 million just not worth it? Well, I think the answer we would give is absolutely not. Of course it's worth it. What kind of a priority this has? Well, apparently not a big one. But we're looking at this start at the federal level without very much accountability back to them, because we don't do the single audit anymore, which is a fine thing, okay? But we should be paying attention to it and looking at their budgets of these agencies, particularly the small ones. And this is by any stretch of the imagination, this is a small agency, and it's on us, not just the agency, not just the legislative committees, but it's on the members of the Legislative Audit Commission to be asking those questions. And why didn't they get funding? You know, how come those chairs aren't here? To ask them how, and I'm sure it would be, well, it's a matter of priorities and no harm, no foul. Nobody's been asking, but we've seen that there are really deficiencies in the way in which we want to deliver this service to, well, at least some of us in here that are needy, if they are needy, who are over 60 years old. So I think I can look at the eyes of some people here, and they are over 60 years old, able to pay for their own meals, but many of their constituents can really benefit from a health perspective for receiving these nutritious meals. And whether they're valued at $20 or $10, what's the difference between $10 and $20 meal? Well, usually it's where it's served. You can get a good hamburger maybe at a small hamburger joint restaurant, but you're going to pay a whole lot more if you try and order a hamburger from Manny's. So anyway, I really appreciate the work that you've done, and both of you, and her, those folks back there. This is a superb start to, I hope, will maybe even at some point, we only do these kind of audits rather than the really narrow ones. And maybe only do 4. At least that's something to think about after we do at least another one to see if we get the same quality of work and recommendations and findings, paying attention to internal controls, which are often overlooked. And I know this has been a special interest of yours, Senator Coran, and I am very grateful.
So Senator Kent, we have spent an hour. I know we have not got to the Board of the Board of Aging. So I want to make sure that we give them that opportunity, and then we'll go back to questions because we have to proceed. I do want to note for members also that there are responses from the area aging entities. I did note there is not a response from DHS to my knowledge. So thank you for the team presented. If we could have Carrie Benson, Executive Director of Minnesota Board of Aging. Senator Grant.
Yeah, and while you're getting situated, we Senator Rest, you highlighted, the rules of the federal requirements and the reporting and all those things. I think when I say we need to look at the legislature, it's what are all those requirements that add value? And I think we have too many places where I think when we look at the rules, as I look at them, in government's very good at enriching its self-worth and value by putting more demands on everybody who provide the services. And so whether it be reporting requirement or whatever, this is really to get at it holistically, that dollar, and for us to work with our congressional members for those bad policies that they hand down to us, and to make sure that we tackle it at every level, but that we can articulate the value or the lack of value in many cases, I think is what we'll find. Administration is very real. What are those costs? And to be able to look at that, I think is where the value is. So it's really a comprehensive look, so we can look at it and say, at the federal level, if we're going to accept $1, does it actually cost us more to accept a federal dollar? At the end of the day, we don't know that. And so that's kind of what we're looking for. And I think we'll be well served by I love your idea of us taking in of our annual selection to do that. This was just to try and create the model. And so we will be well served, but it is to look at the roles at every level, who's contributing, and then where the costs born. You and I at our local Department of Human Services, our locals, counties, a lot of those costs are then borne on this assessment that is unfunded at any level until it reaches them. So that's what we're looking for. And it is a passion of mine. Again, it's my 40th year and I know it well, but I think we at the end of the day, we will all benefit. Every employee that's doing that job, every entity that serves our individuals. And so that's the only goal. So thank you.
Director Benson, welcome. If you could state your name for the record. Thank you.
Thank you, Mr. Chair and members. My name is Carrie Benson. I'm the Executive Director of the Minnesota Board on Aging. I'm happy to be here today to provide some brief remarks in response to the audit report for the MBA's Senior Nutrition Program. The Minnesota Board on Aging is a 25-member governor-appointed board. I am here on their behalf also. And I want to assure you that they take the administration of the Older Americans Act programs, including the Senior Nutrition Program, very seriously. As their executive director, I lead the staff team that supports the MBA and have delegated authority to administer these programs. And I share their commitment to compliance, transparency, and fiscal responsibility. I want to thank Ms. Randall and her team for their work on this audit. As I said in my response letter, I do not disagree with any of the findings. During the audit period, the MBA, in partnership with the area agencies on aging and nutrition service providers, provided meals to nearly 40,000 older adults around the state. We are proud of this service and the impact that we have on the well-being of those older adults we serve. We have done this work with limited administrative funding historically at the state level. As has been mentioned, the Senior Nutrition Program is funded primarily through the Federal Older Americans Act, about 89%. I think Ms. Stone noted, of the funding is the federal funding. However, the Older Americans Act limits the amount available at the state level for administering all of the Older Americans Act programs. And so that has limited our staff capacity, since the beginning of that program, despite requests and, advocacy at the federal level with Congress to ask for changes to that. We are grateful for the 2 staff positions that were funded during the last legislative session for the Senior Nutrition Program. Those were included in the one-time funding that was authorized, and we will benefit greatly from those 2 positions at the state level, specifically focused on this program. During the audit period of 2022, we were in the midst of the COVID-19 pandemic and administering more than double the amount of our usual funding. We have prioritized getting the funding out the door and getting meals to the older adults in need. We were not able to fulfill all federal and state program requirements. For example, as was mentioned earlier, the senior nutrition service providers were not able to conduct the in-person certifications and recertifications of program participants during that time due to concern about spreading COVID. That was just one of the items that were impacted by how we had to modify our program implementation during that time. In 2023, we have been making progress on shoring up our internal controls and achieving full compliance with federal and state requirements. I'm proud to be able to share with you some of the progress we have made so far this year. Tapping into some of the one-time pandemic recovery funding, we've been able to work with an outside contractor to do a thorough review of our federal and state program requirements, our existing internal controls, and program implementation processes, identify the gaps that exist, and begin to address those gaps. The review will be completed next month, and then we will begin to develop our improved protocols and start issuing those. By the end of this month, we will have completed all outstanding financial reconciliations with the area agencies on aging. That would include both advances and reimbursements. We're about 90% complete, and I'm happy to report that we have verified that the area agencies on aging are using state and federal funds appropriately by doing those financial reconciliations, and proud to report, no issues of concern have been identified in those reconciliations. We are in the process of hiring the 2 additional staff positions that were funded last session, and those staff positions for the Senior Nutrition Program will focus on conducting the grant closeout evaluations, conducting the ongoing financial reconciliations, and then undertaking the timely site visits, monitoring visits with the area agencies on aging. I will note those are the site visits that were identified as not having been conducted in person since 2017. Those are the visits between the MBA staff and the area agencies on aging. Other site visits, I will note in that it's included in the report, other site visits had been completed by the area agencies on aging and the service providers. We are implementing barcode scanning technology to track in real time the number of meals provided at each site for each person served. And we are enforcing and getting and back into gear with doing the in-person new or annual recertifications of program participants. Again, this was a practice that was suspended per federal regulation during the pandemic. And finally, we will continue our work with our tribal nation partners as they strengthen their internal controls and administrative processes. We will provide strong support to the organization that will take over responsibility for the newly restructured Minnesota Indian Area Agency on Aging to set them up for success as an area agency on aging in particular to administer the senior nutrition program. In closing, I want to reiterate that I am committed to addressing the issues identified in this report. We have a strong foundation on which to build of committed, long-standing leadership and staffing for this program at the state, regional, and local levels, with our area agency on aging partners and our senior nutrition provider partners, and a track record of delivering high-quality meals to thousands of older adults. Thank you, Mr. Chair.
Thank you. We have a couple questions. Representative Anderson.
Thank you, Executive Director Benson. I have a few questions. When you started doing the site visits again this year, did you find that all the sites existed?
Director.
Mr. Chair and members, not all site visits have been completed yet, but from those site visits completed, yes, all sites that have been identified in those areas exist.
Representative Anderson.
Thank you. That's good to know that this isn't feeding your future. I very much respect the fact that you accept the legislative auditor's recommendations and don't disagree with the report. I think I want to give you kudos for that. And for turning things around, or starting to turn things around, because that's what it sounds like is happening. You're looking towards the future. And if anything, I can say that's what's come out of this process is that we've actually potentially fixed a very bad situation that wasn't being managed and at all, it sounds like. And so even the fact that you requested additional staff last legislative session, of course, that was ongoing as this audit was ongoing. And so you've been proactive for the future again. So I want to commend you for doing that. And it goes to the point of Senator Rust and Coran about the fact that these are good things that we're doing from an audit perspective, because we went into an agency where it was clearly in a program that's good, and clearly significant problems. And through this whole process, we can hopefully really turn this around and provide the services that we intended originally, the federal government and the state. So I just want to point those things out. I won't beat anyone up for the past because it sounds like we're fixing the future. So thank you.
Director Benson.
Thank you, Mr. Chair and members. I greatly appreciate that. And I am looking forward. My team is looking forward. And I just have to thank again the audit team that conducted the audit, and they did a spectacular job, and we worked well together and have, even in the process of it, and since then are very much looking forward and, taking, step by step, making progress.
Thank you. Representative Quam.
Thank you, Mr. Chair, and thank you. There are a lot of small entities such as yours that are doing, good things and filling in expertise in areas. I would think that the larger DHS and other entities would have an umbrella so that instead of you having to have a 0.2 or 0.3 position to do this paperwork periodically throughout the year, the DHS would have a group of people that could handle this for multiple small entities, and they would be expert at it, and that would be their job to make sure that we comply with the requirements for federal dollars. Because, frankly, there's a lot of overlap. But for you specifically, do you know if any of the entities underneath in this program were involved or flagged with other programs for fraud? Because I know there's a repetitive group of entities for Feeding Our Future, some childcare and some other activities underneath these larger agencies. So has there been a review to make sure we're not having groups like that here?
Dr. Benson.
Mr. Chair and members, if I may first just comment on the support provided through the Department of Human Services. And I will note also that I have been in very close communication and dialogue in terms of this audit and response to with Commissioner Harpstead and her team, and have submitted, my response on our behalf. And I apologize for not making that clearer, but have definitely received, strong support from Commissioner Harpstead's team. In terms of entities identified in other instances of potential fraud, since the audit period, I will say during the audit period and since, there have been 2 entities identified that either were potentially involved in a case of fraud, or involved in a case of potential fraud, or were determined after the fact to have been involved. And so for both of those situations, my team with the Area Agency on Aging affected or involved in those situations, and the senior nutrition providers acted quickly to identify those instances and stop payment and contracts in a timely manner.
Thank you, Mr. Chair. So that highlights the fact that if we have DHS and these larger entities sort of helping out, the group of people doing this activity would more quickly recognize similar entities and address that better. So I think as a legislature, we might want to look at improving the global effect, and it'd be more efficient and effective. Thank you.
So essentially, Representative Quam, you're talking about cross compliance.
Mhm.
Senator Grant.
Thank you, Mr. Chair. And thank you for being here, Ms. Benson. One of the responses, the only line of question I have is on the on finding 2, the response was the MBA is going to seek recommendations from the Attorney General's office regulation in regards to contracting and those things. So this isn't a new program. I'm not aware that we've identified new extraordinary requirements out of anything that we've heard today. We've talked a little bit about the site visits and things like that. I don't agree the feds didn't require it, but much of it wasn't happening prior to COVID. And so that's a challenge. But the contracting piece is, it sounds like you're seeking guidance from the Attorney General to build a process or whatever that is, definition of what your responsibility is, the Minnesota Board of Aging on contracting. If it concerns me that we don't know what that is. And so I guess, could you tell me today, what is it that, because it's not being done, but what is it at the Board of Aging in your understanding in your role of contract oversight? And how do you think what guidance is the Attorney General going to provide, since nothing's changed in the last 6-8 years?
Dr. Benson.
Mr. Chair and members, one note I will make is that the Minnesota Board on Aging receives its legal advice and counseling, including grant and contract compliance guidance from the Attorney General's office as a standalone entity. That being said, we do receive some technical assistance also through the DHS Grants Contracts Office, and so we are fully aware of our responsibilities regarding the contracts that we hold directly with each of our 7 area agencies on aging. We are not as clear, given some new federal regulations that have been put in place, what our legal responsibility and our scope is for review and approval of the contracts that providers have with subcontractors. So that's more the case, and where we we and the area agencies on aging, who we've worked extremely closely to get, with in terms of moving forward, really just want to be clear, where does that lie? And to ensure that to the degree to which it rests with my staff team, or the degree to which it rests with the area agencies on aging, then we make sure we have the legal support and capacity to be able to do that correctly and to oversee that.
Mr. Chair, and thank you, Ms. Benson. And so there's a new federal requirement, but I'm kind of still troubled that if you're the head of the program and there's a cascade of an hierarchy down to the providers, you're it at the top. And to not have just whether you're required by law or not, to have good policy in practice to do basic, simple things, contract management and the flow through and oversight of that. It just seems extraordinary that you would only do it if you're mandated by law. And so that's where I kind of struggle, because this isn't something new and nothing changed prior to that. And yet it didn't exist prior to good business process to ensure millions of dollars, federally or state, are properly accounted for and services are provided that we all seek and desire. So that's kind of my challenge, is that we always, every one of these we get to and say, wow, we'll do it now, we'll do it better, we'll try harder. But where's good business process? And I'm fully understanding of the lack of administration, and believe me, and you don't need any more help in so many cases of that, of those guidelines or the unfunded mandate of administrative costs. They're very real. I fully understand. We would like to help ease that burden. We can have still good accountability, right, to meet our obligations and yet streamline that process or reduce the cost of administration for some of those things. But that's where I struggle, right? So good business processes, shouldn't be only required if it's mandated specifically and exclusively by law. That should be our basic principles in practice. So I would hope that as we move forward, we will seek guidance as well. How do we help legislatively to ease some of those burdens and make sure that the administration costs are one, understood, and one, accommodated, but then also executed on. So thank you.
Members, any other questions? Director, I actually do like that you're seeking legal counsel on when federal dollars are coming in to make sure that it's handled appropriately and that we're doing everything right. I think Minnesotans expect that we are a shining star and make sure that we're handling the money well. And so, it takes a little bit to get the council to get legal counsel to get those opinions. And sometimes getting federal guidance, reading CFRs is not that exciting, but is required, and it just takes a while. And so I would note, I appreciate your forthrightness and response here today. It is refreshing and valued. So thank you for being here.
Thank you, Mr. Chair and members.
We are adjourned.